Shakira told us that her hips don't lie, but is she lying about her plastic surgery? Let's find out. At the end, we'll let you know what the potential costs are of these different procedures. This video has been sponsored by Noom. More on them later. In the year 2000, at the age of 23, you can see that Shakira has distinctive hair, she has full eyebrows, she has a nice youthful brow position, with supratarsal crease clearly visible and a good platform. As far as her nose, I'm seeing tip bulbosity and some alar flare when she smiles. Shakira has great tooth show on smile, and she has really no gums showing. As far as her upper red lip, what I'm seeing is some signs of asymmetry, which is very normal, as you guys know. There's more fullness on the right and in the middle compared to the left side. And it looks like she may have had veneers already at this stage. Shakira does have a nice strong chin. In 2001, at the age of 24, Shakira has very prominent perioral smile lines, and this is a very nice natural look. And again, I bring this up in other videos, but for people who try to reduce or completely sometimes eliminate the nasolabial folds, it's useful to see pictures like this of beautiful people in their youth, and these lines, these nasolabial folds, are actually very much normal. So trying to fully efface them should really never be the goal of any cosmetic procedure or enhancement on the face. In 2002, at the age of 25, what I'm seeing here is that Shakira has nice upper tooth show on repose when her mouth is slightly open. She naturally has a high ratio of the upper to lower lip volume, meaning that they're closer to a 1-to-1 ratio. Her philtrum, that area between the base of the nose and the upper lip, is actually relatively short. I'm guessing approximately 13 millimeters in length. In 2003, at the age of 26, Shakira has nice natural cheek volume. She also has this interesting forehead or glabellar piercing. More on that later. In 2004, at the age of 27, Shakira has natural under eye hollow, and that is usually just a genetic type of trait, like me. Hollow. In 2005, at the age of 28, that glabellar piercing actually left a depressed scar. Take a look. There are different options for how to correct this, but it is actually a very difficult area to treat. So options are: do nothing, because maybe it doesn't really bother her, even though it's kind of smack in the middle of the face, but for some people, they don't care. So that's fine, you can just leave it alone. Another option is to do a scar revision, or excising that scar and then closing it carefully. The other options would be using filler to try to elevate that depressed scar so that it looks more flush with the surrounding tissues. That is dangerous in this location. The glabella has a lot of blood vessels, and some of those blood vessels, such as the supratrochlear artery, actually connect with the arteries of the eye, such as the ophthalmic artery. And so when you have that type of connection, if you get filler into this blood vessel, it can connect to a blood vessel further back that connects to the ability for us to see and for us to control vision. And so if that happens, you can actually go blind. Another option would be something like laser resurfacing. The problem with the laser is that it usually doesn't correct depressed scars. So it can help with smoothing out the skin compared to the surrounding area, but not so much for elevating a depressed scar. I'm also seeing in 2005 that Shakira may have had a buccal fat removal, because in her central cheek there's some more evidence of hollowing compared to what came before it. From the years 2006 to 2009, I am not seeing any obvious changes in Shakira's face. Please subscribe to the channel and turn on all notifications. In 2010, at the age of 33, Shakira has started to introduce some Botox, it looks like, to the forehead, the glabella, and the crow's feet, which are the three most common areas to inject with Botox. And the purpose, of course, is to paralyze the muscles in the area so that you get a smooth type of skin surface without the obvious lines or the wrinkles or rhytids present. And that's something that usually has to be repeated every 3 to 4 months to sustain that effect, though there are some newer neurotoxins that are coming out on the market market that actually can last longer, something like 4 to 6 months instead of 3 to 4 months. In 2011, at the age of 34, I'm not seeing any further change. In 2012, when Shakira was pregnant with her first child, I'm also not seeing any obvious changes of anything related to plastic surgery. In 2013, age 36, no change. Today's video is sponsored by Noom. The Noom program has helped me get into better shape before my vacation. I'm not talking just about physical shape, but mental shape as well. With the Noom program, I get to learn about how the habits around the foods that we eat are formed, because there's a strong emphasis on psychology. And given that I like learning as much as I like teaching, the Noom program was really a great fit for me. With the Noom program, it's not about just following a strict diet or depriving yourself of food. Instead, it's about learning how to break bad food habits. It's also about improving your self-awareness so you're more mindful about the foods that you consume. A lesson that I took about a week ago that really stuck out in my mind was about eating less dense. Did you know that 60% of calories in the standard American diet comes from actually processed foods? A helpful tip that I learned from my Noom program is to actually eat less processed foods. This in turn helps you retrain your brain to eat better food that gives you the fuel and the energy to do more things in your life. By listening to Noom and consuming less processed foods, I actually feel more energetic to take on all the different tasks that I do throughout the day. My days are quite labor intensive between seeing patients, doing surgery, and recording for YouTube. So eating less processed foods has definitely helped with that. Habits take time to form, but I think that by continuing to use the Noom program and really logging the category of the type of food that I'm eating, red, yellow, green, I think that I'll be able to form even better food habits. The Noom program matches you up with coaches that help you stay on track with your dietary habits, and you can reach them at any time. There are weekly reports that are available in the app, and that helps me track my progress. If you're interested in signing up with Noom, go to the link in the description to get a free 30-second quiz that will get you started on this amazing journey with Noom. Thank you, Noom, for sponsoring this video and for supporting our channel. Don't forget to sign up for the Noom program by going to the link in the description, or put in noom.com/Gary and sign up to start this amazing journey. 2014, she was again pregnant here with her second child. But what I'm seeing here is that you can appreciate that there's a horizontal upper cutaneous lip crease that's forming under the nose when she smiles. And this is thought to be the effect of the insertion of two depressor septi nasi muscle fibers that are inserting into the overlying skin. So they're inserting from deep to superficial and creating this horizontal line. What I find is when I do lip lift surgeries and when the area that we're excising actually encompasses that area of the line, usually that line does not return. So that's been an interesting finding, something I've observed just from doing that type of surgery. In 2015, at the age of 38, I'm not seeing any further changes for Shakira. Same in 2016 and 2017. In 2018, at the age of 41, I'm seeing some signs of a potential fat transfer to the face. You can see throughout the cheeks there's just this enhanced fullness, and so she may have potentially have had a fat transfer to the area to bring in some stem cells and to try to rejuvenate the area and to bring back some volume as well. In 2019, at the age of 42, what I'm seeing are potential signs of a lower blepharoplasty. You can see a smoother transition from the lower lid to the cheek area. I wanted to mention here that there are different ways to do lower blepharoplasties. You can either make an incision just under the eyelid margin itself, that's called a subciliary approach. You can go transconjunctival, which is on the inside of the eyelid. That is the most common way to perform lower blepharoplasty these days. Main reason being that if you make an incision underneath the lid margin or the actual eyelid margin, you can cause some retraction or ectropion of the eyelid, whereas if you go on the inside of the eyelid, you're more safe as far as that potential complication. In 2020, at the age of 43, I'm not seeing any further change. Same in 2021, at the age of 44, no further change. So contrary to what I've been seeing and reading online, I actually don't think that Shakira had a rhinoplasty. When I look here in 2022, she still has a very similar tip bulbosity. She still has a very similar alar flare and nasal base width when I look at how it aligns with the inner corners of the eye. And also from the three-quarter view, when you look at the overall trajectory of the nose and how there's a slight droop down when she smiles, I mean, all of that is essentially unchanged. So I really doubt that a rhinoplasty was done. The total cost of all of these procedures is $120,000. Since you like this video on Shakira, I know you'll love our video on Dove Cameron. Click on the card and I'll see you there.